Welcome to 6ABC's Weekend Extra, paid for by Mainline Health. Here's Jessica Boynton.
Well, yes, you've been definitely watching the news, and what's been dominating most of it is the coronavirus, and I'm sure everyone has tons of questions. So right here, right now, we're going to get right to it and get all of those questions answered for you. We have the expert here with us. We have Dr. Lawrence Liverneys. He's the chairman of medicine of Mainline Health and Infectious Disease. So no one better really to sit down with us and basically answer all of these burning questions that we have. Thank you so much for being here.
Thank you for inviting me. Good morning.
Yeah, and tell me a little bit about what you do.
I'm an infectious disease physician, and I care for all kinds of patients with infections, bacterial infections, viral infections, parasitic infections.
Right. What is COVID-19?
COVID-19 is a disease caused by a coronavirus.
What are the basic symptoms that you should be looking for?
The main symptoms are three: cough, shortness of breath, and fever.
Okay.
And the majority of people have some of those symptoms, but there are some people who present atypically and may not have all those symptoms. Some people may have no fever at all. Occasionally people have some GI symptoms like diarrhea. So there's a bit of a spectrum. It can be confused sometimes with flu or even with seasonal allergies, and we're blooming right now, so that's starting to be a problem for us.
So what should someone do if they are experiencing symptoms of coronavirus?
I think the first thing to do, if you're concerned you have a coronavirus infection, you should call your physician. Don't go to the emergency room. Call your physician first and discuss what's happening to you. They may tell you to do one of several things. They may say, this doesn't really sound like anything serious, let's keep you at home and monitor and see what happens. They may suggest that you go for outpatient testing, go to a drive-up site where you can drive in and have a swab performed to test for coronavirus, or they may feel that you're sick enough that you really need more acute care and send you to the emergency room or to an urgent care center.
Okay, so call your doctor first.
Right, yeah, I think there's two important concepts there. One, we don't want to have people go to the emergency room who don't need to be there. The emergency rooms currently are very stressed, and we'd rather they be available for the sickest of patients. And two, if you're going to an emergency room, we'd like them to know you're coming ahead of time if there's a concern for coronavirus, so they can appropriately isolate you as soon as you get there so you don't spread it to other people.
So if someone is experiencing symptoms, how did they get it? How did it spread to them?
So coronavirus is a respiratory virus, like the common cold and other viruses that we get. And these are generally spread through two main routes. The first is by direct coughing. When you cough or sneeze, you create a spray. And if you cough in someone's face and they inhale that, they become infected that way. The other way is through surfaces. You could cough on your hand and touch a doorknob, and then somebody else comes along, touches the doorknob, the virus is on their hand. The virus itself doesn't actually penetrate your skin. So on your hand, it's not dangerous to you until you contaminate yourself through one of your mucous membranes.
How are other ways that you can reduce your risk of infection?
There are a couple of strategies. Probably the two most important are, one, we've talked about washing your hands. And you should wash your hands, I think, frequently during the day, particularly when coming in from out of doors, before and after you eat, when you touch high-touch surfaces. Right. In addition, social distancing. There's a lot about that in the news right now. Basically, this is a virus that is spread from person to person.
So how is Mainline Health handling the COVID situation right now?
We've limited visitation onto all of our facilities. Virtually all of our meetings are being done virtually at this point in time. We've ramped up all kinds of internal processes to help us prepare for an anticipated surge of patients into our various facilities, and we've partnered with various public health and governmental agencies. We've set up outpatient drive-by testing centers to help identify individuals who may have coronavirus infection who require testing.
Who can get it? I'm
glad you brought that up. This is, I think, a really important point. There's no question the older you are, the worse you're going to do with this virus. You become sicker with it, you have a much more likely chance to die. And after age 50, the numbers really climb pretty steeply with each decade of life. That's not to say that young people can't get this. There's no question young people can, and we've seen cases, and there are many cases reported throughout the world of young individuals becoming severely ill with this and even dying. So any one of us can actually get this.
Thank you so much for being here. 6ABC and Mainline Health are proud partners of Well Ahead Philly. So we want you to stay safe, and don't forget, wash your hands.
Well Ahead Philly helps you gain access to the information you need to feel better and live well every day. Thanks for watching 6ABC's Weekend Extra, paid for by Mainline Health.